LTFPH.
Okay. Swallow one time.
Checked. Dull. Pressure.
Good. Hi, Emma.
Hi.
I'm Dr. Matt. I'm going to do your annual checkup today. Let's go ahead and verify your chart. Can I please have your date of birth?
Yeah, December 1st, 2002.
Okay. And your last name?
Archbold. ARCHBOLD.
Okay. Any known allergies?
No, not that I'm aware of.
When was the last annual checkup?
About a year ago.
Are you experiencing any pain at the moment?
I have some pain in my abdominal area.
Okay.
I'm not sure if that's psycho-related, and then also in my back of my neck.
Okay, let's talk a little bit about your abdominal pain. For how long has that been going on?
3 months.
3 months. Do you know what triggers it?
I want to say food and exercise, but I'm not sure if the two are actually associated.
I mean, it's something that a lot of people complain about when they are saying they have abdominal pain. It really depends from person to person. So if you feel like food and exercise exacerbated, that must be legit. Do you have pain before, during, or after eating?
I think before and after.
Before and after. Is that with every meal or on and off?
On and off. It's normally later in the day.
Later in the day. Okay. What about exercise? Is it during exercise, after exercise?
During.
During. For how long do you exercise?
At least 30 minutes or an hour every other day or so.
Okay. Every other day. Okay. Any fever or flu-like symptoms? Throwing up?
No.
Okay. Any history of hypertension?
No.
Any thyroid disorders in your family?
Not that I'm aware of.
Okay. Headaches?
Headaches.
Okay. How often are they?
At least once a week.
Once a week. Do you wear glasses?
I do.
Okay. When was your last checkup?
A couple months ago?
Any change?
No.
For how long have you been wearing glasses?
Over a decade.
Okay. And you said no allergies.
Correct.
No allergies to medications, no allergies to foods.
Correct.
Okay.
When I was younger, I kind of had a lactose intolerance thing going on.
Well, you either have it or you don't have it.
I know, so I don't know. Maybe I still have.
Who told you you have lactose intolerance?
My parents, when I complained when I ate cheese that my stomach hurt.
Okay. And did you feel any relief after stopping?
I did, yeah. And I also was taking lactate for a while.
Lactate, okay. Okay, we're going to run some blood work to check for any allergies to certain medications. Some people may become allergic to the different types of foods, even in adulthood.
Really?
So it really depends on everybody's lifestyle, genetics, and also stress levels.
Okay.
So it's something that we could check to see if the foods that you eat may trigger some of that discomfort and pain.
Okay.
Tell me a little bit about your neck.
My neck. It's been going on for a couple months. It's mostly at the base of the back of my neck.
Okay.
It definitely flares up when I've been sitting, but also it flares up after I exercise as well. So
Is it sharp, dull,
I feel like achy, sharp.
aching,
Yeah.
and sharp? Is it constant or intermittent?
I would say it's inconsistent.
And are you taking any medications to help with that?
I try not to take any pain meds, but sometimes it helps.
How would you rate your pain on a scale of 0 to 10? 10 being the worst.
6.
6. And does it start on a lower level and then it escalates? Okay. And when do you feel the need to take medication? Usually like what level?
Like an 8 out of 10.
How often did you get to an 8 out of 10 the last 3 months?
Once a week.
Okay. Have you noticed any changes with your vision?
No.
Okay. Any changes with your hearing, smell, or taste?
No.
Any skin sensitivities? Discoloration?
No.
And what have you been taking for pain? Tylenol, ibuprofen?
Both.
Both. Do you know the dosage?
Extra strength.
Okay. And how often?
Just once a week.
Okay.
About.
And does that usually help to bring down the pain level?
Yes. Definitely still painful, but less painful.
That's good. That's good. Whenever the pain response to over-the-counter medication is a good indication that it's not something too concerning. So we're going to do a checkup and make sure that everything looks good and try to see how we can help you. Are you taking any other medications?
No.
Any surgeries? Any injuries?
I had a thing going on with my IT band for a while, but that was a couple months ago.
And are you experiencing any pain in the lower part of your body?
No.
Okay. Did you have to go to the hospital?
No.
All right. I'm going to have you change into a gown and we'll do vital signs first. And then I'm going to start the head-to-toe assessment. Okay. I'm going to take your blood pressure first. When was the last time you got a blood pressure check?
About a year ago.
Any chest pain or palpitations? Do you ever feel like your heart skips beats? Okay. Okay. 110/60, that's a very good blood pressure reading. Okay. Did you have anything to drink that's cold, like ice cold latte or a very hot tea recently?
No.
Okay. Just because this is going to be sublingual, so you want to make sure that we have an accurate reading. I'm just going to have you hold this for me under your tongue. Go ahead and hold it for about a few seconds. It usually reads very fast. And this is going to go on your index finger. I'm going to register your oxygenation and heart rate. Okay, I'm going to check that. Okay, 36.1 Celsius. Okay, oxygenation is 98% on room air, heart rate 71, blood pressure we said was 110/60, and respiratory rate is 14. Okay. Okay, go ahead and look straight in my nose. I'm going to flash a light in your eyes. We're checking for pupil dilation and constriction. Okay. Go ahead and look right here for me. And now look here. Okay. Gonna have you cover your right eye. Go ahead and hold this with your left and extend your arm all the way up. I'm gonna start with a 20/20 vision just to make sure that your contacts are working properly. Start reading the letters with left starting.
LTFPH.
Okay, go ahead and switch eyes. Okay, go ahead and read starting with right.
HPFTL.
All right, what color do you see here?
Red.
Okay, what about here?
Green.
And which size is smaller? 2 or 3?
2.
Okay. I have here some flashcards. Are you able to identify the number inside the circle?
26.
Okay.
96. 5.
Go ahead and trace 5. Cover one eye. Go ahead and cover your other eye. Trace 2.
26.
Okay, perfect. All right, so your vision does look okay. We're just ruling out anything in regards to the ocular nerve. I'm gonna have you lay down and I'll take a look at your head and scalp just to make sure everything looks good, and I'll let you know the findings at the end and what we can do for you.
Okay.
Let me know if you feel any kind of pain, okay? I'm just going to start with your sinuses. I'm not noticing any fluid buildup or rigidity. Checking the second set of sinuses right under your eyes. Palpating lymph nodes, preauricular lymph nodes. Looking for any signs of lymphadenopathy. Checking submental lymph nodes. to the cervical region. And the supraclavicular lymph nodes. Go ahead and shrug your shoulders for me. Okay, relax. Okay, checking trachea and thyroid gland. Not noticing any nodules. Thyroid gland is within normal limits. Can you go ahead and swallow one time? Good. One more time. Okay. Size is normal. Trachea is midline. Go ahead and clench your jaw. Unclench. Clench again. Okay. A slight delay on the right side. One more time, clench. Okay. A lot stronger on the left side. Okay, go ahead and slightly open your mouth. Close. And now I'm gonna have you open it all the way up, like to the max. Okay, close. Alright, there's no popping sound. Any history of TMJ?
My sibling has it, but
Okay. Okay, before I move from the head area, I want to listen to your heart. Is it okay if I slide the stethoscope under the gown?
yeah.
Normal sinus rhythm. No signs of atrial fibrillation. I can hear only S1 and S2. No S3, no S4. I'm going to check for any jugular vein distension. We're listening for any abnormal breathing. the irregularity there. Kind of check your scalp. Kind of turn your head to the left. Checking the skin for any raised bumps. We're not noticing any edema. Checking the scalp for any raised fluid. I'm not noticing any redness. I'm going to touch it with two textures. Go ahead and tell me if you feel this sharp or dull.
Sharp. 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 Sharp.
And does this feel sharp all the way down?
Yes. Dull. Dull. Dull.
Does this feel dull all the way down?
Yes.
Okay. I'm going to take a sample just to rule out any infections. Let me know if you feel any discomfort. The Q-tip does have a medicated solution that helps to remove and exfoliate some of the skin that we need to collect. So let me know if you feel any type of sensitivity, as some people may have a slight reaction. your head facing up. Go ahead and relax your head. Just gentle palpation here in the back of your scalp, looking for any swelling. Okay, head is normal cephalic. I'm not noticing any bumps or lumps. Good scalp movement. Gentle touch around the nasal nostrils. I'm going to look for patency. I'm going to have you breathe in and breathe out through your nose only. Good, no obstruction there. Same thing on the right side. Breathe in and breathe out through your nose. Good. Okay, going to do slight movements here. Go ahead and tell me if you feel any pain in the septum. Okay. I'm gonna have you take a slow breath through your nose. I have your very relaxing and calming scent. Are you able to identify the scent?
Pine?
Okay. Wonderful. So we're checking your olfactory nerve. We want to make sure that there is no damage around the nerves. Okay. Does it seem the same scent as before or different?
The same.
Okay.
Perfect.
Have you noticed any changes with your taste?
No. Okay.
I'm gonna have you slightly open your mouth. I'm gonna place this on your tongue. It's gonna get wet. Go ahead and close your mouth. Open. Okay, and are you able to identify the taste and describe it?
No.
Okay, let's try another one. Did it have no taste to you or?
No taste.
No taste. Okay. Now I'm going to put a more center on your tongue. Go ahead and slightly open, close, open.
Still no taste.
Okay. Okay. This is one last strip. Close and open. Any taste in that?
No taste.
Okay. I have your tuning fork. It's going to create a vibration sound. I'm going to put it very close to your ear. Go ahead and tell me if you hear it with left or right.
Right. Left.
Okay. Does it feel like vibration or pressure?
Pressure.
What about now? Vibration or pressure?
Pressure.
Which position here is louder? 1 or 2?
1.
1 or 2?
2.
Okay. So the auditory canal seems to be intact. There is no inflammation around the auditory nerves. I'm a little bit concerned about your taste, so we're going to do a few more tests. Let's go ahead and take a look at your abdomen now. Okay, Emma. Just looking first visually to see if there's any raised bumps, any redness or swelling. Okay. Slight swelling on the left abdominal wall. Okay, I'm going to listen to your abdomen. Let me know if you feel any discomfort as the stethoscope touches your skin. Going to prescribe a physical with the gastroenterologist. We might need to do some further checkup. Going to compare with left quadrant. Slight elevation towards the median line. Decreased sounds. Okay, just a little bit of hypoactivity on the left side. It could be from a slower digestion, some food intolerance. So we're going to do some blood work before we make that appointment with the GI. normal activity. Moving down to the left lower quadrant. No sounds of ischemic obstruction. Since you don't have any surgeries in your medical history, definitely we would need to do some more tests just to rule out any physiological answers. Okay, I'm gonna go ahead and compare with the right lower side. There's definitely decreased activity on the left side. I'm going to take some measurements. We're looking for asymmetry. It could indicate some slight swelling. And since your cardiovascular status has been within normal, I think just a referral to the GI would definitely help to solve the puzzle. I want to make sure that you are not in any pain before you go. You haven't noticed any swelling. Slight asymmetry, I would say it's about a 2-degree difference. We definitely wanted to see less than 1. Your measurement at the belly button to see if there's any prolapse. And measure the distance between belly button and intercostal 1, 2, 3, and 4. Comparing with the right side. Okay, I'm gonna slightly palpate. Checking bilateral kidneys. Okay, your urine output was normal. I'm not noticing any asymmetry upon palpation, and doesn't seem to be any rigidity. going in on the lower two quadrants. Seems to be lots of fluid in the left abdominal cavity. Let's go ahead and take a look at your back now. I'm going to listen to your lungs. Since you don't have any flu-like symptoms, no cough, wheezing, it does seem to be a little bit of pleural effusion. Sometimes an irritation of the lung could cause a little bit of discomfort. I'm gonna have you take a deep breath in and slowly exhale. Again. Okay. Bilateral clear sounds. No swelling around the paraspinal muscles, but there is slight asymmetry. So in theory, every measurement should be the same. The only thing that sometimes the touch can trigger contractions into the paraspinal muscles. can in turn affect neck range of motion and cause discomfort, sometimes even headaches. Checking cervical spine, starting with C1 and C2. We have the atlas and axis. No deviations. Normal curvatures. Could be looking at a deficiency in minerals. And that can be caused by malabsorption of nutrients through the digestive tract. So we're looking at slight inflammation here, which can be definitely realigned with a change in the foods that you eat. The good thing is that the pain is mostly localized in the neck area. Sometimes with advanced conditions it could move down to the lumbar regions. Checking for hydration status. Being able to easily absorb and maintain a natural fluid level is part of how well we coordinate the muscles. I'm going to check your spinal reflexes. I'm going to check for a deficiency in potassium and magnesium. Since you didn't feel any electrical pulses down the spine, we're looking at no deficiency. That's a good indication that it could be just muscular. No nerve damage. Go ahead and check your lower body reflexes. Okay. I'm not noticing any warmth. constant temperature on both sides. Checking bilateral pedal pulses for peripheral circulation. 2+, strong and symmetric. Checking capillary refill. Good capillary perfusion. Okay, a little bit delayed on the left side. I'm going to check your Babinski reflex. Slight pressure. Okay. Okay. Do you feel this on the left or right?
Right. Left. Right. Left.
Okay, I'm going to move your toe. It's going to be either towards you or towards the wall. Go ahead and tell me if it's towards you or me.
You.
Okay.
You.
Okay.
Me.
Okay.
Me.
Okay.
Me.
Okay. Go ahead and wrap your toes around my fingers. Okay, slight decrease to reflex on the left side. Go ahead and relax. I'm going to have you push with your pads. Okay, strong bilateral. I'm going to have you push with your heels. Good. I'm going to try to open your legs. Don't let me do that. Good. I'm going to try to close them. Don't let me do that. Okay, slight decrease on the left side again. Now let's go ahead and check your reflexes. Okay, go ahead and relax your knee. Good. Just as expected. Relax. Good. Okay, very decreased on the left side. All right, I'm gonna have you sit back up. Okay, Emma. So I'm going to refer you to GI. We just want to do further tests, but I'm going to send you to them with some blood work. By the time you make that appointment, we're definitely going to have your results back, so it's going to help speed up the process. Okay, I'm going to prescribe, it's kind of like a medicine for the stomach. It coats the lining of the stomach. It's going to help with contraction and also with the GI movement so that you have less discomfort between feedings and when you eat. Otherwise, on the back, I did not notice anything. It might be just some levels of like magnesium or potassium, so I just want to make sure that we're ruling anything like that, and if we fix that, it might help with the back pain as well, because it doesn't seem to be any other abnormalities. Okay, let me know if you have any questions. It was very nice to meet you. Thank you.
Thank you.